Hello everybody, this is Dr. Tran, and recently I have quite a few requests. I have some friends that are traveling and then also have acute back pain, either from carry luggage or helping some loved one, and they don't have accessible to the doctor right away, or they don't have like they was traveling, so they can't get to see a doctor right away, and they keep calling me and say, "Oh, what can I do to help myself until I can see a doctor?" So I'm thinking, let's make this video. And remember, this is only in case of emergency where you don't have access to a doctor, you need some relief right away. This is no mean instruction video on treating back pain. So just make sure we're clear on that. So if you, let's say you were traveling and you bend over, pick up some things, and then your back start hurting and you can't get to a doctor right away, or you're helping some loved ones and injure yourself in the meantime, and same thing, have no access to medical treatment right away. So one of the few things that you can do, first of all, if it's really bad, see, you can get any kind of ointment, like icy hot medicine oil, anything that have menthol or even heat, and put it in the area that causes a lot of pain. But also, if you have a belt, like a regular belt, I just use this as a regular belt, but if you have a belt, you can just put it over, right over, if you feel it, you can feel your hip bone right there. You just tied it around the hip bone, right below the, slightly below the belly button, and just tighten them and pull them a little tight so you can feel some support here, and that actually help a little bit on alleviate some of the pain. And then one other thing you can do, now I know it's when you're in pain, you tend to have like like that, lean in like that. So get to the floor if you can, and then lay flat on the floor just like this. Now if you lay like this, it can be very painful, but stay here for about a minute, and then slowly so you can lift your head up with two of your fists tapped together, and start like that and lay here for a minute. And if you can feel, first it might be painful, but it should be alleviated after a minute or so. And then if you can tolerate the pain and it's not as bad, then slowly you can get on your elbow and lay like this, and breathe in and out, and stay in this position for another minute, and then slowly get back up here like that, and then slowly get up and see how you feel, and then repeat that a couple of times. But remember, like, do it at your own pace, don't rush through this, and then repeat the process. And then same thing, go back down here, and then if you get comfortable here, you can actually slowly lift yourself up a little bit like that. Okay, and then you can also find a towel or something that you can roll up, and you can lay down on your side first and roll over your back, and make sure your leg are like this, and slowly lift yourself up and put the towel right there. Just start from right at your pelvic area, right at your waist, and put the towel right there, and then slowly drop your hip into the floor and see how you're feeling. If you still, it's not too much pain, stay there for a minute, and then slowly straighten one leg out, and then just the other leg, and then stay here for a couple minutes. Now it might be also painful to do, but if you can, do that for a minute or two, and then bring your feet back, lift yourself slightly up, and push the towel slightly about 1 inch above the last place you put it. And then same thing, drop your hip down, and then slowly straighten your leg out. And And same thing when you're done, make sure you slowly lift it up, move the towel, and turn to the side, whatever side you can get up, and slowly get yourself up. Now, a lot of time when you have a sudden back pain like that is you usually sprain the muscle, but also you might have existing condition that you don't know about. So the inflammations, swelling that cause the pain. So first thing your body do is try to protect you by tighten all the muscles surrounding it. So if you can just do some of these slow exercise to let your body know that it's okay, it's safe, and do it slowly, that actually help to reduce the swelling and also reduce the spasm. Because the spasm, the protection the body start when you're first having pain, is what create more pressure on the joint or on the nerve and on this itself. So if you slowly do this exercise and then put some heat, you have some hot heat pack on it, ice pack, whatever you can get accessible to, put on it, that slowly can ease it. But as soon as you get back to see accessible to a doctor, the physician, please go there right away. Don't take it lightly, because if you're this healthy, there's no way a little bend over can injure you. Most of the injury happen because you already have chronic issues that you don't know about. The disc already weak enough, so just that bend, just push the last straw, just push it over the edge. So please take care of it. Make sure you see a doctor, get some x-ray, get imaging, and find out why and what caused that. A lot of time your body is too weak to do that sort of motion. It's not because of that activity that caused you to have injury. The injury already there, the weakness already there, that injury just show you that your body is too weak for itself. So please address them as soon as possible. So I hope this helped. And once again, this is no mean to treat back pain or low back pain. It just means for emergency uses when you can access to a doctor right away. So I hope this helped.